So, good morning, good afternoon, and good evening, everyone. Welcome to the 337th day of continuous Zoom session of Ifph. Let us start with a silent prayer for 1 minute. Today, on 3rd August 2021, our Chief Guest is Dr.Sheeba, MD Homeopathy, from Government Homeopathic Medical College, Trivandrum, Kerala, India. She is the medical officer from the Department of Homeopathy. Now he is also working as the state convener at SADGMAYA, that is Center for Adolescent Healthcare and Behavioral Management, Department of Homeopathy, Government of Kerala, India. She is also a writer, poetess, wrote a lot of poetry and a very much talented person. So on behalf of Ifph, I am welcoming you, Dr. Sheeba. The topic is adolescent behavioral, scholastic issues and addictions. Now it's over to you, Sheeba, you can proceed, please.
It's the same way as Sir has mentioned. Good morning, good afternoon, and even to some it may be good night to everybody who is attending the session. First of all, before I start the session, I would like to express my sincere gratitude to Dr. Shaji Varghese and Dr. Manoj, who is my teacher, for presenting me this wonderful opportunity. Thanks a lot, sir. So we are dealing today with our session, scholastic issues and ADHD, because it's a long topic. We need a little bit more time to cover all the things. So we are just starting the session with scholastic issues first. So let's start our session with Diagnostic and Statistical Manual for Mental Disorders, that is DSM-5. With an overview of it, we'll start our session. So you know that this classifies disease into neurodevelopmental and neurocognitive problems. I think many of the doctors present here are very familiar with it. So this is ICD-10 classification of mental and behavioral disorders regarding clinical descriptions and diagnostic guidelines. I would like to say that homeopathic department is making use of ICD-10 in our presentations, as well as our diagnostic features in SADGMAYA, as we are entering all these things online. So let me start with the commonly encountered pediatric mental illnesses, which starts mainly from anxiety disorders. I will explain autism spectrum disorders, behavioral disorders, conduct disorders and ODD, mood disorders, depression and bipolar disorders, and also commonly encountered other illnesses like eating disorders, schizophrenia, substance abuses. And first of all, let me start with learning disorders. So before I start with my session, learning disorders, I would like to know how many of us have seriously taken learning disorder as a problem. How many of us have taken it as a fiction? Okay, so the most brutal thing you can ever do to your student or your child is to label him as a slacking off person or as a lazy person before identifying or knowing the real disorder as a learning disability. When we used to study in our early classes, there was no such classification or there was no such diagnosis regarding anything like learning disability. But for today's children, we are here to identify what is their problem with learning and to identify if they're having some serious problems. So learning disorders are one of the most common disorders to affect the children. And there may be deficits in reading, math, language, communication, writing, coordination, and expression. So let me start with dyscalculia. So for the doctors who are actually listening to the session, I would like to know how many of you are dyscalculic. To truly tell you, many of us are. That's why we rid of maths very early and got our plan forward with science. Just think of your maths class. Okay, how easy and how nice it was for many of us. So it's a specific LD that affects a child's ability to understand, learn, and perform math and number-based operations. Many of us never knew we were dyscalculic. Many of us were performing high in many other subjects, but getting poor marks in maths, but never knowing what is the real problem with us. Perhaps it can be a dyscalculia. So when basic math factors are not mastered earlier, that is, you are struggling to understand basic math facts, and children and adults with dyscalculia may have trouble moving on to more advanced math applications. So these require that a person should be able to follow multiple step procedures and be able to identify critical information needed to solve equations. So math disabilities can occur as a result of some brain injury too, in which case the proper term is not dyscalculia, it is acalculia, to distinguish it from dyscalculia, which is of innate genetic or developmental origin. So this is 1 + 1 is 3. It's okay if I have dyscalculia. Before when we learn what is dyscalculia, it is okay for them. Okay. So regarding young children, always it starts with a delay in learning to count. You teach them how to count. You fail. Desperately you fail. You become frantic, but they can't learn to count. And there can be a trouble recognizing printed numbers. Okay. And they can't connect numerical symbols like 5 with their corresponding words 5, 5e. That is, they may write 5 and in letter they may write 4, F-O-U-R, because they can't connect that idea and they lose track when counting. They may be counting, they lose track in between, and they need to use visual aids like fingers to help counting. Some people, after using your fingers, they even go to their toes. Still, they didn't get the answer. Don't get the answer. That's a problem with them. And there is a poor memory for numbers too. And there's a trouble organizing things in a logical way, putting round objects in one place and square ones in another. This you find in very young children. That is, you have to know it is very visible in their very young age itself. We never understand it. That's all. Then regarding school-age children, you'll be having a struggle with maths because when the class starts itself, the math will give you problem. Homework, assignments, and tests, these guys will always be lagging behind. They won't be able to follow. They can't estimate how long it will take to complete a test, and trouble with learning math facts like addition, subtractions, multiplications, and division, and difficulty in developing math problems and solving skills, and poor long-term memory for math functions, difficulty in measuring things. Some people will be able to say a distance in kilometers, but when you ask some people to say distance, they will say in minutes or time because they can't just get that distance, and avoiding games that require strategy. Then warning signs by age in teenagers and adults, there'll be a trouble, difficulty in estimating costs like grocery bills. If you send this person to grocery shop, you are in trouble because they are very weak in money matters, such as making a change because they don't know how to give a change, how that money thing comes. Counting bills, they can't do it. Calculating a tip or estimating how much something will cost. We have got a common idea of how something will cost and how much tip we have to give. We have an idea. But regarding dyscalculia, this is a very difficult thing. And there'll be a trouble with remembering numbers. How many of you forget your phone number? And how many of you still struggle to remember your car numbers? I know some persons who use stickers in their car key. So that at night when some police just stops them, they don't know what is the number of their car and they're in trouble. So they use stickers to write their numbers in the car key and say it. So this is a problem. Okay, don't get frustrated with this. We have got a lot of problems. One among them is dyscalculia. It's a minor thing we can overtake. Okay, we can tackle it with the sticker idea. What is wrong with it? So there can be a problem with remembering numbers such as phone numbers, game scores, very difficult for our little children. Then you remember PIN codes of yourself. I can't. I don't know how many of you can. You forget your zip codes, and all these things can also be symptoms of dyscalculia. So also there can be difficulty in judging the length of distances and how long will it take to get from one location to another. They can't just specify it. Then they'll be struggling to remember directions. How many of us are able to say north, south? Sometimes, you just lose your control. You don't know how to remember directions. Not with everybody. We all are having LDs in a short way. When we judge it, we'll be knowing. And they'll be having a hard time telling left from right. Have you ever acknowledged it when you are having it? Children, they usually get a trouble getting the right shoe. But regarding adults, they forget left, right. They need a proper idea. When you are suddenly asked, you won't be able to tell it. And they'll be having difficulty reading clock and telling time. They'll be reading the clock and telling time when they're calm. But when it is suddenly asked, they just get confused. That's a problem with dyscalculia. Then performance issues. These kids may perform well in other subjects. That's a problem here. Maths is not the most important thing to judge a person. You should never get an idea into that. What is the problem with other subjects? So we have got a famous film dialogue by Mohanlal. The last pulsation of world never lies in maths. It's not maths. Maths is not the last way to identify your IQ or your ability to judge a person. In our country, I don't know how, in this world, those persons who are familiar with maths and technology, they are identified as intelligent persons, and others are remembered not so. But that's not right. So these kids may perform well in other subjects. They can do very well in English or history or Malayalam, but have very low grades in maths or math-based classes. So that's not an inference that they're poor or they're having lower IQ, only that they're poor in maths. So how can it be diagnosed? There is no specific test to diagnose dyscalculia. Your experience tells it that you have got a problem like that. Visit your doctor to rule out any medical issues if your child is having such a problem. So rule out any medical issues, like if there is some hearing or visual impairment, you won't be able to do so. Consult with the teacher. Ask about other areas too. Okay, how they're performing in other subjects. So they may be better in other subjects and they may not be. So you have to take care. If they're poor in everything, you have to go for an IQ test and find out if there is some intelligent quotient deficient, and you have to substitute for it. Understand your child's complete learning profile. That is, you have to keep track of your child. Once you have completed this groundwork, consult a professional who can evaluate your child and give specific feedbacks. So how can dyscalculia be treated? So helping a student identify his or her strengths and weaknesses is the first step to getting help. So who is going to do it? So if you're a patient parent, perhaps you may do it. But you know what is happening with our kids? It's a frenzy that's happening in their home, because we usually keep it as a success rate, okay, for our child to perform high, and it is our judgment. Most of the time we presume too much and are frustrated, and after that they become depressed, and you come calling out like they are depressed, you have to give treatment for that. There is no point in it, right? So helping a student identify his or her strength. There may be other fields where they're very fluent and where they are very achieving. You have to find out which one and give them that. Then parents, teachers, and other educators, all of them can work together to establish strategies that will help the student learn math more effectively. This is the position where we need a professional. Homeopathy has got a project called Sadgamaya. It has got treatment as well as professional help for all these learning disabilities. We have got a special educator and clinical psychologist, and our special educator usually judges all these complaints given by parents, and we judge it. We diagnose it. What is the right, what is the problem, and what is the right cure for them. So the parents, teachers, and other educators can work together to establish strategies that will help the student learn math more effectively. And there must be repeated reinforcement and specific practices, straightforward ideas that can make understanding easy. So that was about dyscalculia, which is one among the major attended learning disabilities. Now let me tell something about dyslexia. So I am dealing with major learning disabilities. First one was dyscalculia. Now we are going with dyslexia. I hope most of the persons are familiar with the term dyslexia, because almost all of us Indians would have seen a film called Tare Zameen Par, where Amir Khan is acting as a hero. And you know what is happening with the child there. And that is a typical example of dyslexia. It's a lifelong challenge. Dyslexia is a lifelong challenge. It can hinder reading, writing, spelling, and sometimes even speaking. It's not a sign of poor intelligence or laziness or of complaint of impaired hearing or vision. Neurological disorder that causes their brains to process and interpret information differently. That's a problem with them. They are not processing the information correctly, just as we do. So what we have to do is we have to show some empathy to them, other than giving them hard tasks and finding out what they can do with that. So remember that it's a lifelong challenge. Dyscalculia, all these LDs can be a lifelong challenge, but you have to find out a proper way to manage it. That's the best method. Okay. So when your child is suffering with reading, writing, spelling problems, and even speaking problems, be patient. Try to identify what is the problem with him. So these persons are usually late talkers. Almost all LDs, all learning disability children will have some milestone delay. So these guys will be late talking, learning new words slowly. So your kid is learning new words slowly. He can't get it so often, just like any other kid. Problems forming words correctly. They can't form it correctly. They need time for that. They may reverse sounds in words, confuse words that sounds alike. That is, most of the dyslexic persons will be confusing B with D. But when a small kid is confusing B with D, it's quite natural. Okay, but when it goes on, when he is going to higher standards and he still is confusing B with D, that's the trouble. So when you go through the notes, you can see instead of writing so, S-A-W, they will be writing was, F-A-S. Instead of writing left, they will be writing as felt. So this is a problem. And while spelling these things too, they can get a trouble. So they may reverse sounds in words, confuse words that sounds alike, and there will be problems remembering or naming letters, numbers, or colors. Also, in small kids, you can find a difficulty in learning nursery rhymes or rhyming games. They may not be used to it. There will be difficulty in spelling. Most of the time, the parents and teachers are getting frenzy because these people cannot write or spell correctly. How much time you waste for them to teach the spelling, they'll be losing it. So there will be difficulty in spelling. That's a problem with them. Can't sound out the pronunciation of an unfamiliar word. This is a trouble. Most of the time, people may think of this as stammering. And this child will be brought to you with a complaint stammering. He stammers. Actually, he's not stammering. It's not a problem with stammering. He's suffering to give the word rightly out. So he can't sound out the pronunciation of an unfamiliar word. That's the trouble. If the word is unfamiliar, he takes a long time uttering it correctly. And it takes a long time completing tasks that involve reading or writing. So these guys immediately fall back when they have to read or write. They can't do it in a continuity, and it will be a pathetic harassment for him if he is made forced to come to the stage and read or write something. Then difficulty finding the right word or forming answers to questions. That means you can mug them up with some questions, but if it is asked in a reverse manner, they won't be able to find out. They can't form it by themselves. That's happening with the children. Trouble learning a foreign language. Hindi, try for Indians, if they learn Hindi. It's a very easy language for many of those who are not dyslexic or dysgraphic. For some people, they suffer. They may perform well in maths. They may not be dyscalculic, but they may be dyslexic because they have a trouble learning a foreign language. For them, can't understand difficult idioms or jokes. Don't try to give hard words for them. A piece of cake, if you say, for just being easy, they won't be understanding it. They can't get the core of that joke. So they will be just looking at you amazed. That's all. So these are the 10 variations of the word teapot written by dyslexics. See, what a variety, what an individualization. So if you write teapot, these guys, 10 persons are given to an idea to give right teapot. They may give such a visible picture for us, vivid picture, right? That was about dyslexia. So I would like to say a case of a dyslexic child of mine who got full A+ this year for his 10th grade. And he was so happy. What we did in Sadhyamaya for that child? Actually, we gave him constitutional homeopathic medicine, of course, but we surely gave him a lot of confidence. Our special educator did a lot of work to bring him up. Our counselor did a lot of counseling to grade up his confidence. And he's a happy child now. I'm so happy. He took 2 years nearly to write out what he can. And when I went through his notebook, I was really seeing that kid's notebook there, film kid's notebook. Same thing. Everything is reversed. Now, at least he's able to write it in a proper manner. He can read and write. I'm never confident that he'll be making higher grades, but still I'm sure he'll be making a good living with his study because he's doing it. Now, let us see what is dysgraphia. So this is another learning disability, which is a deficiency in the ability to write, primarily in terms of handwriting. So I know most of the people who are having a very bad handwriting will be wincing now. Okay, so what is happening with me? So is it a problem of dysgraphia? LDs can be mimicked, right? Those persons who are slacking off or those who are actually very lazy and demotivated can mimic all the LDs and may say that we are LD, so we can't do it. So that's why we usually say never give an idea to child that you have got a problem. Never tell them that you have got a problem in front of them. You have to tell them slowly that the problem part is here, we can make it okay. Never tell them that you have got a problem with LD straightforward, because most of them will take it for granted. Okay, I have got an LD, so I can get low marks. It's not that. We have to work hard to bring them up, right? It's our duty. So this is a deficiency in the ability to write, and primarily in terms of handwriting, but also in terms of coherence, not handwriting alone. So it's a transcription disability, a writing disorder associated with impaired handwriting. Definitely it would be there. And finger sequencing, the movement that muscles require to write, the finger sequencing will be bad. I had a case of a child who had this problem. She used to be a very good learner, a very good student of the school. But what happened is that whenever she writes an exam, she gets 4 marks, but nobody can read it. Especially when she is tensed, she loses all control. Her letter becomes wavy. We can't read it. So when we assessed the case, we found that it was a case of dysgraphia because all the other symptoms were present. we could clear it after a long time of continuous evaluation and treatment and trainings. We could clear her. So here you can also get irregular letter sizes and shapes. And also there will be poor spatial planning on paper. Persons who start writing a sentence from the top of the paper and they'll be going up to the moon. They can't write it in a straight line. So that is a poor spatial planning on paper, which is happening with dysgraphia persons. The person who is first dealing with paper can have such a trouble. It's quite common. When we started writing, we all had it with plain paper. But after how much time you take, you're not improving on your spatial planning on paper, you may have a problem like dysgraphia. Then there can be misuse of lines and margins. That won't exist for them. Misuse of lines and margins, excessive erasures. How many times they make the erasures, they don't know. Switching between cursive and print letters, switching between caps and small letters. Some guys do this. They are starting a sentence with the caps and he's going on and he's making the cap in between the sentence. That is quite abnormal. You can get it in dysgraphia. Tight, awkward, painful grip of pen or pencil. There's a way to handle a pen or a pencil. It's a general way. We teach the students so that the muscles won't get tired, they won't get pain. But these guys, they just tightly, awkwardly, painfully grip on pencil or other writing utensils. And as usual, they may be feeling while writing. Example, they'll be having finger cramps. Then odd wrist arm paper orientation. What do you mean by that? Bending arm into an L shape while writing. That's not a normal writing, right? Placing pen not in the correct position of your finger. You can get a finger pain there. And that is also an odd finger orientation on paper. So all these things can be features of dysgraphia. This is something called dyspraxia. So dyspraxia is a development coordination disorder. Okay. And it's also known as clumsy child syndrome. You know why? These guys usually get whipped by their parents and teachers because of their clumsy nature. But unfortunately, it's not planned. It happens. It's not an ADHD case who goes trampling their friends down. It's just a clumsy child syndrome. It's a chronic neurological disorder beginning in childhood that can affect planning of movements or coordination. They can't do it, unfortunately. They struggle to distinguish left from right and have extremely poor sense of direction. So there's a trouble picking up, holding on to simple objects such as pencils owing to poor muscle tone and proprioception. Clumsy to the point of knocking things over and bumping into people accidentally. So with little kids, this is quite common. So some people with development coordination disorder have difficulty in determining left from right. See how many LDs have got the same problem, determining left from right. Problems with chewing food. They won't be making a good presentation while they're eating. We won't be wishing to see them while they're eating. They'll be having problems with chewing food. Trouble determining the distance between themselves and other objects. Actually, this is what is causing their trouble. They can't actually identify what is the distance between themselves and others when they will collide. That time gap is valuable. They just collide, they just fall down. Now, before dyspraxia, the dyspraxia that is about LDs. Now, please let me tell something about ADHD, attention deficit hyperactivity disorder, which is not actually calculated in LD, but it is having almost all the presentations because they may be presenting just like an LD. They may be having severe academic issues. So we have to go with ADHD, that is attention deficit hyperactivity disorder. So it is identified by failing to pay attention to details, making careless mistakes, difficulty with sustained activity and organizational issues. So if you have a child with ADHD somewhere near or in your home, very probably, most probably, you'll be knowing because they are such destructive kids. You'll be very well knowing what the problem they are making with. So the major problem they're making is, of course, attention difficulty, hyperactivity, and impulsiveness. Of a child who cannot sit still, especially when they are put calm. I'll be explaining the details. Constantly fidgety. That is the nature of an ADHD child. There will be increased physical movement and increased talking. You may say a loquacious child, a talkative child who can't wait for their turn. They can't wait for a cue. They can't wait for a turn. They will just rush and they will just be impulse. So this impulsiveness is a major important presentation of ADHD. Can be defined as hyperactivity, attention issues, or both. So though many children show some of the following behaviors, a child exhibiting, so I'll say what all are the clinical presentations. These are the clinical presentations. Inability to sustain attention. They can't sustain their attention. Obviously, children are not so attentive. They're not so attentive. They are very small kids. But here, there is an inability to sustain attention at all. However, it is fairly easy to tell if a child has extreme difficulty paying attention to anything, even enjoyable activities for more than a few minutes. A child will naturally get bored when he or she is forced to sit for a while. But here, even for seconds, they won't be making that attention. Then constantly distracted. How will you teach such a child? How will you ever make such a child focused? So here there is constant distraction. Children, they are often distracted by sights and sounds, but parents may want to monitor child's behavior. There are other symptoms present. Children who seem completely unable to sustain attention beyond a sight or sound may need to be tested by a doctor for ADHD, because that's a very strong indication for ADHD. Then difficulty sustaining eye contact. Here, never get trouble with confusion with autism, because most of the cases, loss of eye contact, we usually confuse it with autism, because these kids, the problem is entirely different. Here, it is a problem with their hyperactivity and their impulsiveness. They don't have a time for fixing eye contact with anybody else. They're very busy. But in autism, they're living in another world. Okay, these children never belong to our world, and they will never allow us to enter to their world. That's why they're not keeping attention. They're not at all. It's not that they're paying attention. They're not here. They're not in the world. That's about autism. But here, there's a difficulty in sustaining eye contact. It seems to be a product of the inattention and hyperactivity, leading a person to constantly be in motion rather than sustaining eye contact. That's the problem. That's the problem with it. So they can actually devote all of their interest into one activity at a time, so long as they're hyper-focused on the issue. See, most of the parents will come to us and tell that these guys have no problem with their learning abilities because he can concentrate on a video game. He's very well interested in a film. He can sit for hours. He can remember all the scenes in it. He can remember all the scores in a video game. So what is the trouble with them? Why it happens when it matters with study matters a lot. So this is the trouble. They are able to pay attention to their high interest things. That's why. So since they are making high scores in video games, never think that they're not ADHD. They can sit there idle. They can, because that's a high interest attention thing. So in adolescence, parents may see this as video game addiction, the most worst addiction we are facing now in lockdowns. And children with ADHD may also be able to stay only in high energy activities. You can never rely them on slow activities. If you're making a running race, they'll be there. If you're making a fighting competition, they'll definitely be there. But you can never make them read or write because it's a slow activity. They're not interested. Then excessively hyperactive and always in motion. One of the key symptoms of ADHD is, of course, the hyperactivity. All kids seems to be hyper. Sure, all of them are hyper. When they get good friends, they will go hyper from one time to time. But there's a breaking point for this behavior. If a child is always in motion over the course of an entire day, this is a problem. There is no waning of energy. How this energy comes? Okay, maybe a sign of the symptom. Children traditionally have waves of energy. But if a child appears never to rest, it may be time to contact the pediatrician, because he's working and working, running and running, making all those things. Still, he's not tired. He can work more. No sleep. He can even play at night. These children usually have less sleep, right? So here it can be a symptom of ADHD. There's a lack of interest in reading or cuddling because they have no time. They're not interested. If a child is so wrapped up in an activity that there is a disinterest in social activity, child needs medical attention. Here also, we needed proper differential diagnosis from autism. Lack of interest in reading or cuddling can again happen in autistic children, but that is entirely different from the presentation ADHD. So there's a difficulty calming down. Most children get excited. Calming children down after he or she is excited is never easy, but there's a behavior that goes beyond the norm. Some of the cases that is presented in Sadgamaya, I'm just amazed at the violence kids can show and how parents are suffering. So please let me say of a case I recently had in my Sadgamaya OP. So how about things that can be dangerously done by our Sadgamaya kids? There's a limit for that, right? So this guy had a peculiar history of nearly smothering his father. His grandfather is the most lovely person he ever has got, but there was a fight between them. He was denied of something which he asked. He just smothered the old guy with a pillow, and it was a narrow escape. He could have been a criminal in that age. So just think about it. So this guy was diagnosed ADHD not because of this impulsive activity alone, He has got a peculiar history of climbing to the terrace of a flat, and he just tried to climb down through a rope, and he was saved with the help of fire force. Very fine child. And also there are many stories of him which are we are not having much time, that's why I'm leaving those. He also used to have a good habit of spitting to the heads of people who are walking beneath the flat. So with all these good characters, he was brought to the OP with diagnosis of ADHD, interior problem child, a nightmare for the parents and what the teachers. Okay, so when I was taking the case, there was a lot of interruption from him because he was continuously interrupting with conversations. He was giving ideas, and he was correcting his mother. So it took a lot of time. He even distracted my mobile. Okay, with a short time, they will distract everything. Very destructive persons. They have the capacity. Okay, very careful about your health, and very careful about the word they use at you. Most of the time, you'll be a little bit amazed at the way they can show it. So there is no fear. That's a simple presentation of ADHD. There is no fear. They are not at all shy. They will do anything. They don't have a fear. So they won't be shy. So these guy had, I was planning on what to do with this child because he was going with all the common presentations of ADHD, but he had a constipation, which was very peculiar. He had to lean very far back to pass his stool, and there alone he cried. He cried aloud. That was a loud cry from him. And he had a love affair in his 5th year. And they even brought a love letter. I read, laughed and laughed. Good Lord, what a language. Okay. So he's a playboy from very young age, and he's interested in it. And so this guy was prescribed, along with his generals, I just gave him a dose of Medona 1 month, with all his symptoms being covered. To tell you, frankly, I never expected such a massive response from that child in his condition. So within 6 months, I can surely say he was able to sit in a chair calmly. And I think that's a great thing for me, because I have never told you that he has become upright. He's not perfect. He studies. No, he's not. He's not studying well. He's not perfect, but he's calm. He can now sit in a chair and talk to me. He's not at all distracting my things. He's asking at least my permission before he takes it. He still goes on with his love life. He's still interested in girls, but that's a good quality. I'm not taking it. I don't want to curtail it with him. But this is the thing. He's okay now. He's calm, and his parents are right. So highly impulsive. A key symptom of ADHD in other age groups is impulsivity, and ADHD patients often act without thinking, and children are no different. This word, that is action without thinking, this is what is happening in all those struggles. They can distract others. They can harm others. If these kids fight, massive dangers can happen to the other side. Okay, they will beat violently. They will kick violently. They will never judge what is happening with the other side, because it's a frenzy and it's an impulsivity. That deep people, many of us have it. When we are in anger, we lose our control. There are some persons like that. They can destroy the whole home. They can even set fire to their home when they are impulsive. So such impulsivity can be a symptom of ADHD. They're accident prone. These parents will be getting fed up, bringing these children to hospitals. Most of the time, a torn hand, a torn leg, a broken leg, all these things can happen. So they are bound to get injured at some point. However, if your child seems to have more accidents than normal, that he's continuously getting plastered of his limbs, it may be indicative of difficulty. You have got a problem with impulse control. If a child does not have a sense of accidents, it may be wise to bring this point with a doctor. Then behavior modification strategies for ADHD. And can I please know what is the time I have left to complete this?
Okay, I think you can continue for another 10 minutes.
Fine, sir. So I hope we'll be completing the session with ADHD. I'm not taking 10 minutes then, because we won't be getting for other topics too, and you have to discuss. So regarding the behavior modification strategies for ADHD, first of all, it is changing the attitude of the parents. Parenting is a great thing. How many of us are skilled in it? How many of us know how to parent a child? That's another issue. So before setting any plan into action, take some time to review how the parents typically react to the child. That's part of the physician. The parents has to take 1 or 2 weeks to change their view of the child and the situation at home. What is the situation at the home? I would like to say that ADHD is never a matter of parenting problem. It's not at all. But worse parenting can make a worse child out of an ADHD. You know why? Most of the time, the culprits are grandparents. They cuddle the children so much, they pamper them so much, and they make the worst child out of them. And they come crying. He's beating me. He's killing me. Please try, doctor. Help me some way. Because they made it. Okay. If you teach a child just to attack others, okay, even playfully, if you are teaching it, never expect that it won't happen to you. Just like a boomerang, it will come to you. In an older age, it will be very severe too. We should be very careful while dealing with these children. Never allow them to attack. Never allow them for such defensive activities using their fighting skills. Then focus on one behavior. ADHDs will be having a lot of troubles. They may be poor in their academics, they may be poor in their behavior, their language sense, everything is a spoiled brat. So there may be many things, but about the child that the parents want to work on improving, but they may be talking back. That's a problem with parents mostly. These children give good answers back, not completing their homework, not completing their chores, antagonizing brothers and sisters, or not listening at all. In order to make change lasting, focus is needed on one behavior at a time. Don't think that you can change a person within seconds or within minutes or within weeks. It's not possible. Take a slow turn for it. Wait for it. That patience counts much. And pick a reward system. Here, I usually ask the parents, when is it that you reward a child? Have you ever rewarded a child without being asked? Most of the time, there are two kinds of parents. I have to say something about helicopter parenting too, because there are some mothers who run around their kids, always asking for, should I help you? Do you need food? Do you need drink? Can I help you? Can I help you? This is a problem. And most of the time, the children never appreciate a mother like that. And the most victim of mother will be such a person who's very lovely to his kid, to her kid. So we have to know when to cuddle and when to be serious with them, when to be more careful with their behaviors. That's a problem. So rewards do not need to be monetary too. And initial rewards can be stickers for little children, check marks, or a good job appreciation. It won't do with many of them. Then interim rewards can be staying up late on the weekend, not for us, of having a friend sleepover. We are not allowing our children to have a friend sleepover. Still, there can be other things. We can let them play with their friends for a little bit more time. Place a chart in the study room in order to see the progress. Pick a consequence. So make consequences appropriate for the child's age. And if the consequences are determined beforehand, the parents will be able to deliver them calmly. Don't just pick the consequence at the instant. You have to get planned with it. Then consequences can be such thing as 15 minutes early to bed, no television or no video game. 15 minutes early to bed is not a big problem. They'll adjust. But if there is no video game, it can be a serious consequence for them. So never think that picking up a consequence, giving them a punishment is never beating them up. Beating them up and beating them up. Some places it is needed. I will often say that that is needed for a time, but here you can give other punishments too, like no television, no video games. You can, but when you say it, you have to practice it. If it is a word, it should be taken, it should be granted, and it should be granted by all of the family. So when we are telling like you have no television today, he'll go to his grandfather or grandmother, he'll cry, and the grandfather or grandmother will appear. I have granted him that. The condition is finished. You can never pick a consequence with that. So it's a planned idea how you're going to deal with the child. Hopefully, if the whole family, so we need all of them together in our OP to give them counseling. Please don't spoil the child. You are showing a lot of love, but what is love? Love doesn't mean giving everything what they wish without ever giving them an idea how much it costs. They must know how much it costs. They must know what is the financial status of your family. They must know what you are going through. Never hide anything from them while you are parenting. Then picking a consequence will be more easy for them. Then consistency in doing what you are suggesting as a consequence. Being consistent is the key to making any behavior modification program work. That's a core of it. The more consistent the parents are, the better results. So you should not fall in front of their cries, in front of their requests. You should stay strong. Discuss what the parents are doing with caregivers and teachers to ensure that everyone is working towards some goal. So you have to let the teachers know when the diagnosis is made. Don't let them consider a child as an enemy or a problem child. So if it is a real problem with the child, perhaps teachers may understand it. Then it will be easy for both of them. Then flexibility with rewards. Adding variety to rewards will help to keep the child interested. Rewards may be periodically changed without changing the rules. But when will you give a reward? Only when you get a very creative response from the child. When you are suggesting and he is receiving and you are confident with it, give the reward. Otherwise, it will go wrong. So let me hastily say some myths about ADHD too. ADHD is not real. My God, that's a great myth. ADHD is real. All those who have gone through ADHD children's treatment and those who are having ADHD children at their home, they will say ADHD is real, real, real. So it is listed in the DSM, which is the official mental health Bible used by psychologists and psychiatrists to diagnose psychiatric and other brain disorders. Children outgrow ADHD. Do you believe it? Children outgrow ADHD? So the great majority of children with ADHD continue to exhibit some symptoms of ADHD into adulthood. More than 70% continue to have symptoms of ADHD into adolescence, and at least 50% will continue to have it as adults, though many clinicians feel this estimate is low. But the real problem is that within this time, his study, his academics, his character, his behavior, everything will be lost and he will be made into a fixed criminal. That's not what we want. So we have to know that they may outgrow ADHD, but we are not taking chances. If you're finding a case of ADHD, find out a professional, take the treatment. All children with ADHD are hyperactive or impulsive. So there are some subtypes too where we may not be presenting this. ADHD is caused by bad parenting. Here, I have to mention that I have never said that ADHD is caused by bad parenting, but I will say that ADHD is flourished by bad parenting. So ADHD is a neurobiological condition often inherited. Parenting children with ADHD can be a real challenge, causing much guilt for parents. When does this guilt come? By beating them up, by not giving them what they are wishing. So who are unsure how to best handle children who are hyperactive and impulsive. But parenting styles do not cause ADHD. Remember that parenting styles can badly as well as goodly affect ADHD. Sugar causes hyperactivity. Actually, earlier studies have debunked that myth, showing children who seem to become more hyperactive is consuming a lot of sugar fun at parties and at other activities that stimulate them and their activity level. However, there's a small subset of children, approximately 1 to 3%, do seem to have food addictive sensitivities. But here we have seen that in most of the cases with autism and ADHD, many of us are telling them not to take sugar. It can cause hyperactivity. Then children with ADHD have a low IQ. So children with ADHD do not have lower or higher IQ than the general public. They are just like any other. The problem with them is their impulsivity and hyperactivity. Then girls rarely have ADHD. Good Lord. There are so many girls with ADHD and they can outdo boys many of the time. So I hope we have come to the end of our session regarding ADHD and learning disorders. Manoj sir, so hopefully we can go on to a discussion if it is present and wind up the session.
Yes, very nice presentations.
Thank you,
Dr. Manoj, I have a few announcements to make, 2 announcements actually.
Okay, please.
One is regarding the paid Zoom classes conducted by our President, Dr. Ismail Said, for the fundraising of IFPH. I appreciate all our participants should help IFPH in attending, especially the doctors should attend the paid classes of our President, Dr. Ismail Said, who is one of the most generous homeopathy doctor who shares his vast experience and clinical tips with our listeners. So it is also very needed and helpful for the fundraising of IFPH. So one class is already over, and the next class comes on 7th of August, and the third one is on 15th of August. So I appreciate all our participants to join the paid classes of Dr. Ismail said. That will be in English. And we have one more paid class in Malayalam that is for agro care by the former one of the patrons of homeopathy, very experienced in agro care, Dr. Abdul Latif sir. So that will be on. There will be one class is already over. The other one comes on. Two classes are already over, but there will be. It is a 6 days program of Dr. Abdul Latif. The next classes will be on 7th, 8th, and 14th and 15th of August. So Dr. Abdul Said's class for the entire program of 3 days, it is rupees 500 for regular participants, and for students it is rupees 250 only. And Dr. Abdul Latif sir, it is for 6 days, it is rupees 400 only, and per day it is 100 rupees. Then the second announcement is regarding a change of time we are planning. On the 340th day, that is the 6th of August onwards, we are thinking of changing our time schedule of our daily Zoom meetings from 8:30 to 9:30 to 8 to 9. It is a possibility, it is yet to finalize, but it is a short notice. I am giving a earlier announcement so that those who regularly participate can take note of this. From the 340th day, that is the 6th of August, Friday, coming Friday onwards, if ever it will be approved by the steering committee of IFPH. It is yet to be approved and finalized. So it will be announced within a short period of time, and the Malayalam program will be from 9 to 10 onwards. Thank you. These are the announcement. I again appreciate our participants should join our fundraising program and help IFPH. Thank you. Over to Dr. Manoj.
Okay, thank you, Doctor. Very nice presentation. So let us discussions. Those who are interested in the participant discussion, please go to the participant list and raise their hands. So now, Dr. Sheeba, you can close this screen
Sure,
share.
sir. Okay, sir.
Oh, yes, right. Is first, I think, Dr. Lokmani Gupta, please.
Hello.
Yes, audible, please.
Thank you, sir. A very good decision and a very good discussion. The time needed program to learn about the development of the child. Ma'am, you had given a very good presentation, but my one question is that if these are the children's problem or these are the learning problems, the unit families today where husband and wife are unable to give the proper time to the developing child can also increase these all problems, or they are the congenital problems. Main thing, as I think, is to train the child. In our early childhood, we were taught the tables. We were taught the tables of 2, 3, 4, 5, 6, 7 to calculate. We were taught the tables of half, quarter, 3/4, and these all. And this whole practice has gone to the calculator. Even every child is doing the calculations with the calculator. How can he be a calculative? So I think the main need with the medicines is to train a child properly by the parents, by the supporters. This is my opinion.
Sure,
And ma'am, do you agree with it?
sure, sir. Sure. You are extremely right in what you are telling. But a lot of time think, what is the matter with maths nowadays? Because we are counting only with calculator. We are not even using our mind to make a math calculation, right? And why did we study all these formulas and problems in class even for our today's life, right? You are right. We need training.
Thank you, ma'am. Second thing I want to convey to the platform that I attended the class of Dr. Ismail Said, sir. It was a very interesting, very educative class. So I also request all the participants to please attend the classes. They are duly benefit. They will increase our knowledge, and the funds will definitely continue over this activity. With this, I conclude myself. Thanks a lot.
You are muted, doctor. Manoj, doctor, you are muted.
Dr. Anand Deswal, please. Please unmute Anand Deswal. Yeah. Yes, yes.
Ma'am, it's a very wonderful session. It's very neat to such type of session in homeopathy. Because of here, some other refer to. It's very neat such type of session and such type of cases to deal with the homeopathy. I have a question regarding my nearest one. A boy, the age is around 15 years. The IQ level is subnormal. He is very poor in study in everything. At the time of birth, the case was he is difficulty in breathing. After some time, the child is crying. Then after he start fits convulsion. After 5 years of treatment, they come into normal. But here the case is the child is unable to very handwriting is very poor, and he all time read 14 hours up to he can study, but he did not get a single sentence from the study. He is now class 9. Due to COVID situation, the situation is going to a other. I want to some suggestion and guidance about this case now.
Sir, I think he has got some physical complaints too, right? You were not audible in between. I couldn't hear you much. He has some physical complaints too, right? He has got some convulsions.
He's got the convulsion at the age of initial at the birth time from 0 to 5 years. He gets some convulsion and anticonvulsant medicine. The doctor prescribed. Now the parents told don't give such type of medicine. It's harm. Then he stopped the medicine. But the problem is I have the IQ level is subnormal around 65. He is not a good handwriting. He all time mistakes. Even he 10 hours, 12 hours reading, studying, but he not able to. But he is the last bencher on study and marks. I want to such guidance. Is there anything to improve?
Yeah, sir, please raise his confidence. Please tell him that he is not the last person who is making a poor academic history. And please tell him that academics is not everything in this world. There are many other jobs. There are many other ways. There are happy things in life. Okay, so if you have got a real problem, you are working hard still you can't improve, find out a professional who can help you. A special educator can find out what is the problem with you and find some tricks to teach you in a different way. You can set a good timetable, okay, which suits you, not for everybody else. You can have homeopathic medicines which can improve your attention and which can help you remember more. Set a different method of study for that child. Okay, that needs intervention from special educator as well as psychologist. He needs a counseling session. We can give him medicine, control his convulsions first, make him a fit child, let him know that he's okay. Backbenchers are not the worst persons in this world. Actually, they make the world. We people who are usually in the front bench, we don't make much. We just go through our academic studies. We make some heights there. We are not known in this world, but backbenchers are valuable. Okay, so he is a backbencher not because he didn't try, he tried. So he is a real best person. He's a gem. Just raise his confidence. Give him some good ideas. Okay, if you can do that, please use your system. Persons who are with you, help tell them to seek the guidance of somebody else, like special educators. If he needs some speech therapist for communication skills, he can go for that. If he's an introvert, change his character. You can do that. Give him good life skills to follow. Okay, and make him confident. I will just say make him confident. That's the best thing you can do. He will
Yes.
improve, sure.
Yes, doctor. Okay, Dr.
Thank you, ma'am.
Sheeba.
Thank
Now,
you.
Dr. Asha. Dr. Asha, please. Yes, Dr. Asha, please.
Okay. Good evening, doctor. The doubt which I have is that, see, in the present day situation, both parents are working.
Yeah.
So both of the kids are either brought up by their grandparents or they have some maid who come to in their help. So will this situation lead to ADHD child?
Ma'am, can we change the situation? This is a problem with all of us, right? We didn't make it forcefully. This is the world. This is what is happening in today's world. You can be very sure that this can make worse complaints out of an ADHD child. Most of the time, you can't bring an ADHD child due to this problem. There will be an ADHD, then it will be aggravated by this. If the case is already present, it will be aggravated. The other children, they won't be presenting with ADHD symptoms, but they will be answering back to you. They'll be behaving back to you. That is because of the parenting skills you are applying and the seclusion they are forced to follow. Okay, in lockdown, what they are doing, we are actually keeping them inside our homes and going for jobs, right? And they're inside, they're secluded, they're introverted. That's their trouble. So what you're asking, if it can aggravate the complaint, surely it will aggravate the complaint. But alas, find out some way. Find out a quality time. When you are back at home, be with your children. Make your quality time. Play with them. Okay, make up for the time you haven't been with them. Okay, make them okay. Love them. It's okay. So whatever be the trouble, there must be a solution. We can't cry out loud telling that there are troubles. They are. We'll find out a reason for that. It's a happy life.
Yes. Thank you, doctor.
One more question.
Okay, okay.
Can a child being brought up from a situation where both parents are not near him or they are say separated by some matter, one personal reason, anything. So can that child in future develop ADHD? Or say the parents are just quarreling in front of child, or this child become introvert or backward in all things, academics, everything. So will that in future lead to ADHD?
He can present with symptoms of ADHD. You know, even if he hasn't inherited it, he can show the symptoms of it. Because actually, you know, when is a child getting calm? When he is getting a calm atmosphere at his home, when the family is broken, when the child is battered, you can expect it there. You can get all the symptoms of ADHD there. Even if you won't be diagnosing it as an ADHD from the very younger age, he will be presenting all the symptoms. So what are the symptoms of ADHD? He won't be showing impulsivity in the manner an ADHD child is showing, but he will be impulsive. He will be answering back to you. He will be kicking you out when you go and argue with him, because that's his frustration being shown. Then he can answer you back. He can be inattentive. All these things can happen. But even if you are not naming it as ADHD, I will say that there will be almost all the symptoms present, except for may not be hyperactivity. But the other things can be there.
Doctor, we have to finish at 9:30. Dr. Shaji, would please?
Yeah, Dr. Sheeba, it was a nice presentation. I have only two questions, fundamental. Did you ever look into the causes that produce ADHD?
Sure, sir. As she presented, there can be familial matters. It can be an inherited case. Even you can inherit through pregnant mothers when they're having battered problems with them. A lot of things. But most of the time, you can get a child with no complaints for their parents also can get ADHD. That's what I found out.
Okay, that's what I want to bring to your attention, as you are doing great jobs in your Satkamaya project. I also wish you to look into the state of the stress situation of the mother during pregnancy as one of the important causes of ADHD. That's all. Thank you.
Okay.
Thank you. Nice.
Now, doctor, this time to wind up the session. Farid Bawakan, please say a lot of thanks. Farid Bawakan, sir, are you there?
There is one more hand raised, Dr. Muhammad Saidan from Turkey.
You have to finish.
Yeah, okay, just to give 1 minute, Dr. Saidan, you finish it just 30 seconds only, please. Yes. Dr. Saidan is
Hello,
from...
do you hear me?
Yeah, please.
Yes, do
please.
you hear me?
Yes,
Uh,
yes.
What is the doctor point of view about sugar intake? Because sugar will elevate the oxidative stress in the body that will affect the neurons, which will express as ADHD. It might express as ADHD disease. Do you believe in that, doctor?
Sir, actually, it's a controversial question. Previously, it was believed that sugar can produce the changes, but nowadays, the ancient science is not at all, no, the modern science is not at all believing in such a myth. The sugar is not the factor that is aggravating ADHD. It's not making much problems. Actually, why we are keeping the children off from much sugary things and candies, it's good for their health. But I don't think it is a problem that is aggravating their ADHD. We are not supposed to treat them as diabetic patients, right?
Yes,
This is on the theory.
Okay. Ajit Bhavakar, sir, please.
Yeah. Dr. Sheeba, good evening. It was an excellent presentation, no doubt about that. The subject is so vast that you will not be able to cover the entire subject sheet in a single session. We are looking forward to see next session, another session, I think in due course.
Sure,
Excellent
sir.
presentation with facts and figures and also with the proofs and all that. You could answer entire questions very beautifully. I appreciate that. Time to spend more. So I'm expressing our thanks from the bottom of the heart to you and wish you all the best. Thank you. Fine.
Well, that was the end of today's session. Day 337. Back to Dr. Tanesh. Thank you for your participation. Thank you.